Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Then levodopa. Levodopa is a prodrug. It is mainly introduced by Horniquets and Quartzias. In almost 1962, it is introduced. This levodopa is actually a precursor of dopamine. It is a precursor of dopamine. So, on giving levodopa, first and foremost, hypokinesia and rigidity will resolve first. Later, tremors will resolve. Then we have secondary symptoms. What are the secondary symptoms? Secondary symptoms like posture or gait, handwriting, speech, or facial expressions, mood, self care, and interest in life. All these are normalized slowly and gradually, normalized over time. So, in this levodopa, on using the levodopa, the first problem or side effect of levodopa is presence of wearing off phenomenon. What is this wearing off phenomenon? In wearing off phenomenon, actually each dose of dopa improves the mobility. Each dose of dopa will improves the mobility only for a period of time, like for example, for a period of time, that is for example like 1 to 2 hours, and after that the rigidity will come back, that is the rigidity and hypokinesia or akinesia will return rapidly. After that period of time it returns rapidly, so this is called as wearing off effect. So the rigidity, hypokinesia which are present in the person will return rapidly to their original state at the end of dosing interval. Okay, this is wearing off phenomenon. There is also called as on and off phenomenon. What is this on and off phenomenon? In on and off phenomenon, in this the patients may fluctuate between the periods of on that and the periods of off. So what does that mean? If the period is in on state the patient will develop the side effects of levodopa. In on state the patient, already in on state there is drug is present, so the patient will develop the side effects of levodopa. Okay, whereas in off phase levodopa dose is decreased. Because the levodopa dose is decreased in the off phase, so the patient will develop immobility and rigidity, and also akinesia in the off phase. So this is seen over time at the later stages after using levodopa for a prolonged period of time. Pharmacokinetics of levodopa. Levodopa is well absorbed and it is metabolized in the intestinal wall. Half-life of levodopa is around 8 hours. Levodopa is actively transported and it is metabolized in the liver also. It is metabolized in the liver to OHMD. Okay, thus levodopa is also absorbed, um, well absorbed, but the absorption is reduced by protein meals. So levodopa absorption is reduced by protein meals. Then side effect of levodopa. Levodopa can cause side effects like nausea, vomiting may be seen. With postural hypotension, the patient may develop arrhythmias, hallucinations are seen in the patient with dyskinesias. and the patient will also develop dyskinesias. So the treatment of dyskinesias which develop due to this levodopa is actually amantadine is the treatment of dyskinesia which is developed due to the side effect of levodopa. Contraindications of levodopa are there can be acute narrow angled glaucoma is seen. The patient will develop peptic ulcer disease, then malignant melanoma is seen in the patient. So in malignant melanoma or in acute narrow angle glaucoma and peptic ulcer disease, this levodopa is contraindicated. Next, drug interactions of levodopa. Then this levodopa should never be combined with D2 blockers, because this levodopa is actually a dopamine agonist. So if you combine with the D2 blockers, obviously the therapeutic effect will be lost, and it is also not given along with drugs like tricyclic antidepressants. It is not given with monoamine oxidase inhibitors. Okay, then it is also not given with pyridoxine or B6.
Thank you and thank you for watching.